All right, so what we're going to do is today we're going to be focusing on humans. We're kind of moving into human population growth. So we're going to talk about age structure diagrams to start with. Now, when we talk about age structure diagrams, these are a good way to look at how a population is going to change. Because we're looking at how a population is going to change, we're going to be looking at an age structure diagram and looking at like biological sex. So we're basically interested in who has a uterus that could grow a baby and who doesn't, because that's what we care about for population growth, okay? So it is going to be a little bit more simple than maybe our modern understanding of like gender and stuff like that, but it will say male and female. We're talking about just that biological sex component. So here are some age structure diagrams. Usually we're going to break them up. I'm going to just talk about the picture at first, and then we'll go back and kind of look at the other details that we need to know. So these diagrams have your age on the y-axis. So it's the age in years. Usually we break people up into about 5-year cohorts. So it would be like ages 0 to 4, 5 to 9, 10 to 14, that kind of thing. And we will chunk them based on their reproductive status. Because remember, that's all we're interested in is, can these people have babies? How is that population going to change? So our pre-reproductive age will be the bottom, usually 3 sections. Usually for humans, we group it into sections of 5. So we consider the 0 to 14 age bracket to be pre-reproductive. And then 15 to about 44 is reproductive. Now, that doesn't mean people cannot have children outside of those ranges. I know we've all seen in the news of, a 13-year-old who has a baby, or of someone who's 50 who has a baby. It happens. It's more rare, especially in like the US. In some cultures, some ends of that spectrum might be more common. It's just going to really depend. But that's what we're going to consider for our reproductive age and our pre-reproductive age. And then post-reproductive age, we usually start at about 45. Most women will be able to continue to have kids until for maybe a couple of years after 45, but it's much less common. So we're going to kind of cut it off at that 44. So the 45 age bracket is usually where we start post-reproductive age. Now I say women because men will be able to continue to provide the sperm component until death. Men don't have any kind of ending of their reproductive years. There's some evidence that maybe older men will have a harder time like getting someone pregnant, like their sperm won't be as healthy, but they could technically still do that. But what we're interested in is the uterus, because that's what we're going to measure all of our like human reproductive stuff on, is how many babies per woman or per uterus. And it's easier that way. Number one, we know who has each baby because it's hard to not know, like to not notice if you're giving birth to a kid. It's a lot harder if we're talking about males because they're not physically carrying the child. So it's a little bit different. And then number two, it just kind of makes it easier for us to think about like fertility rates and things if we're looking at just per the 1/2 of that like equation. Does that kind of make sense? If we try to think of it as like per person, it can get a little bit more muddled. So we're gonna focus on the female and the uterus. All right. So just the basics of human population. We're going to kind of go back and then we'll look at some different population pyramids and talk about growth rates and stuff towards the end. Total population sizes of the world is over 7 billion. The US is the 3rd most populous nation right now with over 300 million. We've got about 330-ish. It was 325 in 2017. But we've had a little bit more increase since then. Demographers are people who are basically population experts, and they look at a couple different things. So they look at total fertility rate. That's the average number of children born to a woman during her lifetime. So again, we're going to focus on the woman here because it's a lot easier to know how many kids she's had. Replacement level fertility would be the average number of children that a couple might need to replace themselves in a population. But again, we're going to focus on per woman. So replacement level fertility would be usually around 2.1 children per woman. Usually that's like 1 to replace both parents, and then a little bit extra because some children will die in like childbirth, miscarriage, and then before they reach reproductive age. In some cultures where we have higher rates of infant death, that replacement level fertility in countries that are like still developing, maybe don't have clean water, replacement level fertility might be higher. It might be like 2.3 or 2.4 because children will die in their infancy because they don't have like access to clean drinking water. And that would be our infant mortality rate. So our infant mortality rate is going to affect that replacement level fertility. And infant mortality, we're talking about the death of children under the age of 1. So we're talking about like stillbirths, so children who don't survive childbirth. But we're also talking about kids who die before they reach 1. There's a lot of things that babies are much more susceptible to than older children and adults. There are lots of diseases. We get vaccinated to a number of them, like whooping cough used to be a big killer of kids. And then diarrheal disease. Diarrhea is a killer worldwide. We don't usually have as much problems with it in the US because we have good water infrastructure. So our public water that we get if I turn on the tap is not going to contain a bacteria or a virus that can cause disease. And also, if a kid does get sick, we have a lot of ways to rehydrate them and to maintain the balance of salts and things. We have easy access to like Gatorade and emergency room hospitals if a kid gets really bad and needs to go on an IV. In the developing world, a lot of times they don't have access to even that, like the minimal like Gatorade to be able to like replenish. Because the problem with diarrhea is you're losing water, but you're also losing electrolytes. Those salts and those what we call electrolytes, or what the marketing company calls electrolytes, can help with things like muscle function and nerve function. So if you have a diarrheal disease over a long period of time and you lose too many of those, it can cause things like seizures, and that can lead to death. And then we also are going to talk a little bit, and we'll talk about this next week too, because we're going to do math on all of the population stuff as well, the crude birth rate and the crude death rate. So whenever we talk about a crude rate, we're going to look at per 1,000 people. So instead of it being a percent, it's going to be per 1,000. The reason we do that is because it's easier to like envision those numbers in your head. Usually the crude birth rate is going to be like 10 individuals per 1,000. If we made it into a percent, that would be like 0.1%, which seems so small that it's hard to imagine those differences. But if we're talking about the difference between like 10 and 20, that's a little bit easier for us to kind of understand than the difference between 0.1 and 0.2, even though mathematically it would be the same. So crude birth rate, crude death rate, that's going to be per 1,000 individuals. We also need to take into account people who move into the population, so immigrants. So immigration or emigration, those are people who leave the population. So in order for someone to move into a population, they had to leave some other population. So I always remember that immigration, which I always pronounce with an E at the beginning, usually it's actually pronounced emigration. But emigration and immigration sound a lot alike, right? I remember that E stands for exit. So E for exit. All right, so now we're going to go back to those age structure diagrams. So our demographers, they need to know all this information, and in order to figure out what's happening with the population, they can look at these age structure diagrams. Basically, what we can do is we can look at future growth and infer social changes, predict future changes. We can also see if there's a disparity in males and females. A lot of times we'll see disparities if there's been like war. Because typically most militaries are going to be more heavily male dominated than female dominated. So we're going to see that that would change like the number of males if there's war and there's a lot of males who die. Sorry. In the US, we can actually look at that one and see some of these changes on the pyramid. So before I pull up a US one, I want to look at these pyramids again. So I told you about reproductive, pre-reproductive, and post-reproductive. When we're looking at this pyramid to see if the population is growing, shrinking, or stable, we're going to look at how many people are in the pre-reproductive group versus in the later groups. The reason is in the next, 10 years, 15 years, the people in that pre-reproductive group will then be reproductive and will then be having babies. So when you have a very wide base and you have a lot of people in your pre-reproductive group, when they get to be of reproductive age, they're going to have many more babies. So the wider the base at the bottom, the more the population is growing. If the base of the pyramid is just a little bit wider than the middle, the population is increasing slowly. If it is about straight up and down, then it would be stable. And if the bottom is narrower, if the base of the pyramid is narrower than the top, that is a shrinking population or a decreasing population. So this would represent like the people in this reproductive age group, many of those couples would have had only one child, so that we get this smaller population here. Each of these pyramids will have different problems for a society. So a society that is increasing rapidly is going to need a lot of infrastructure for young people. So schools, after school care things, daycare centers. A population that is decreasing is going to need a lot of things that people who are older might need. So healthcare, nursing homes, infrastructure that supports social life for elderly people. So things like libraries are often one of the things that we see elderly populations really want. So depending on what the population looks like, what your diagram looks like, that can tell cities, states, countries, what kinds of things they need to invest in infrastructure in. Is their population looking like it's decreasing? Then they might need to invest in infrastructure that is going to support an older population. Is the population growing rapidly? Then they need to invest in more schools. So this can kind of help cities get ahead of it before they end up with a public school class of 45 kids because they didn't build a new school building. All right, so I want to, before we move on to the total fertility rate, I want to go ahead and look at the US population pyramid. Yeah, let's see if we can get a 2019 one. All right. Okay, so this is 1960. So this is the US in 1960. And what you can see is the US in 1960 has kind of a weird shape. And that's probably because this age group here, 20 to 30, is a little bit narrower. Why would the 20 to 30 age group, do you think, be narrower in 1960? So think about, when was World War II?
The young people were.
Yeah, so Vietnam, we'll see, you can see the effect of Vietnam too, but that would be a little bit later. But if you think in 1960, people who are 30 would have been about 15 when the World War II was happening. A lot of them may have been in the war. You could have had some of these younger men, especially 18-year-olds and stuff, fighting. There's also Cold War stuff still happening after that, Korea. We could have gotten a lot of those men being killed in war. Also, you may have had just fewer numbers of births at that time. You have kind of a little bit of a baby boom immediately after any given war, usually in the US. So if you look at after World War I, there's a little bit wider. After World War II, there's a big wide. That's this bottom here is the baby boom. So these extra births down here are from all of the people who made it back from war having a lot of kids. If we look, this is 2015. So we can see here we have the baby boom, and then we have the echo boom after. So the baby boomers in 2015 would have been between about 50 and 65 or so, right in here. And then this is your echo boom, which would be your millennials, would be part of that echo boom. All right, oops. Okay, so now, oh, go ahead.
I was about to ask, Do all the percentage like add up to 100 on
Yes.
each?
So the way it works is the total percentage would be 100. Yeah, this one's a percent graph. So if you added up all the percents here and here, you'd have to add up the male and female, it would be 100. This one is showing us actual numbers. So it depends on what the graph shows, what information we could get.
Okay.
Does that answer your question, Joanna?
Yeah.
Okay. All right, so now we're going to talk about total fertility rate. This is the number of children born to an average woman in a population during her entire reproductive life. So we are talking about people with uteruses, how many babies they're going to have during their entire like reproductively able life. There's a couple things that can impact this. First off, it's the education of women. Women who are higher educated, they go to more school, tend to marry later and tend to have their first child later, so they have fewer reproductive years. Also, when women are educated, they often tend to have jobs outside of the home, so they might be more likely to prioritize going back to work or working while raising kids. So they may have fewer kids just because of the demands on their time. Age at first childbirth. If someone is starting to have kids much younger, so 18, 19, having their first kid, they've got a lot more years that they can have kids. Food availability. Food availability can make it harder to get pregnant if someone doesn't have a good, like, nutritious diet. Health problems. So people will tend to choose not to have kids if they have other health complications. Medical care can also affect total fertility rate, especially for women during childbirth. Some women, if they don't have good medical care, they end up having like a hysterectomy, which might remove their uterus so that they can't have future kids. Emergencies like that can happen, and they're going to happen for people who tend to not have as good medical care during their pregnancy. And then, of course, cultural practices. A lot of different cultures will have extended time for mother and child after childbirth. One of my friends, when I was in grad school, she was from China. And I went back after I had had my oldest daughter. I went to visit all of my grad school friends and kind of show off the baby. Because I had just graduated like 6 months or so before. So I went down, and my daughter was maybe a month old or so. She wasn't super little, but we were visiting my husband's parents who live in the same town that I went to grad school in. And we go there, we're visiting, and my friend who is Chinese was like, "Why are you here? You should be only by yourself at home," because in her area, and I don't know if this is all China, but I know it's in her area, people will have like a month or more where they just stay in like a specialized hospital or at home and have people bring them food, and nobody sees the baby except really mom and dad. And maybe the like parents of mom and dad. So like in-laws or her mom would be there like to feed her, and she wouldn't do any work if she had just had a baby. So those kinds of cultural practices can vary between different societies. Also, some places have like extended like parental leave from work, which that can allow for like parents and children to kind of bond more. And it can change how many kids you have, because if you're getting like, if you have a year off for parental leave, you're much less likely to have more kids, because a lot of times you don't want to like use that too many times. So in countries where they have that like year-long parental leave, places like Switzerland, Norway, a lot of the families there have maybe 1 to 3 kids. They get this extended period to stay home with their kids, and then they go back to work, and they're not really incentivized. And it almost doesn't make sense. You might think if they're going to get time off work, maybe they would have more kids. But it seems like it works kind of the opposite. They use that time off, but then they also, when they go back to work, they are happy to be back to work. So if total fertility rate is at replacement level, or at replacement fertility rate, the population growth will be at about 0. That should make sense. If all we're doing is replacing the people, population growth rate should be pretty close to 0. Infant mortality rate, this is the number of infant deaths per 1,000 live births, is impacted by a number of different things. Number one, medical care. If you don't have good prenatal care or medical care during childbirth, higher likelihood that the baby is going to be injured or die. Access to clean water. There's an estimate between about 10 and 20% of women, we think, cannot produce enough breast milk to feed their baby. So if a woman can't produce enough breast milk, she's going to have to rely on formula. A lot of places, the easiest way to get formula is to get powdered formula, so you mix it with water. If you don't have access to clean water for mixing that formula, your baby is much more likely to get sick. And like I said before, diarrheal illnesses can be a big killer of babies. Now, I want to kind of focus on the US for a minute, because the US is kind of a weird, we have some weird stuff going on with infant and maternal mortality here right now. In the US, infant and maternal mortality, which maternal is death of the mother that is related to childbirth or pregnancy, both of those things are higher for BIPOC individuals, so BIPOC women and babies, the Black, Indigenous, and people of color. And there's a couple of different things causing this. Number one, access to healthcare. Access to healthcare that is not steeped in systemic racism would be a good start, because there are problems with like controlled studies that have like a Black patient and a white patient who come in, and these are like actors, they're not real patients, and they come in and they say the exact same symptoms. The white patient is more likely to get more pain medication and to be believed. We saw this with Serena Williams. After she had her daughter, I think, she said something wasn't right. She had like previously some issues with different, like clotting, I think it was, and she told the doctors she didn't feel well and they didn't trust her, and she almost died. Luckily she didn't, but that happens to so many people. Women tend to not be trusted as much as men, so we've seen that in studies. And then on top of that, women of color tend to be trusted less than white women by doctors. So their experiences of what they're feeling are not taken as seriously. The other thing is that a lot of times Black patients and other people of color are tending to give birth at more poorly funded hospitals. This is the same for our Indigenous people in the US. We tend to have very poorly funded hospitals. They might cut corners. They might not test blood pressure on discharge. That one test, and just having the nurses to do that one test, which is pretty simple, it's a blood pressure cuff. You guys have probably all had that done, can catch people who have preeclampsia. So it can catch these issues before they become big problems. Also, availability of prenatal care. It's hard to get it in some neighborhoods. And then higher rates of pre-existing conditions. Many of these are due to environmental factors. Things like environmental inequity or environmental racism are the terms to kind of search if you want to look into that. But a lot of those relate to things like high blood pressure, asthma, obesity, because of not having access to a lot of food that is like high quality nutrition. These things can cause these pre-existing conditions that can then worsen outcomes for mothers and babies. And then availability of high quality food. Often communities of color are found in areas called food deserts, where they don't have access to like a good grocery store with fresh fruits and vegetables. Also, eating healthy is more expensive than eating like McDonald's. So there's that aspect too. Now there is another aspect of this in the US. We are also seeing rises in maternal mortality due to people having birth at home, so home birth. In most of the world, in order to have someone give birth at home, you would need a midwife who was pretty well trained in medicine. So if you're talking about a midwife in like England, they have a nursing degree. If you're talking about midwives in the US, we have two kinds. We have a certified nurse midwife. Those are the ones who work at hospitals. They have a nursing degree and then a master's in midwifery. We also have the midwives who do home births here have maybe a high school diploma or a GED. That's all they have to have, bare minimum of education, and then they have to watch some childbirths. Because they don't have that education, a midwife doing a home birth doesn't have things like blood pressure cuffs or the training with which to use those, or equipment to resuscitate a baby if the baby is born and isn't breathing yet. Midwives in the US who do home births often don't have access to all that stuff. Now, not all, there are some that are doing a lot of that same stuff. It's going to depend on state to state, but states that have really lax laws about it and have people just like basically saying they're a midwife and it's like, okay, you're a midwife, have higher rates of maternal mortality and infant mortality outside of the hospital. And we're talking babies are like 8 to 10 times as likely to die in a home birth than at the hospital. So it's a pretty big increase in risk. So that's another aspect of this kind of thing that is unique to the US as far as developing nations go. Most other developing nations have much stricter requirements for midwives and for home birthing. All right, this next section we are going to wait on, this human population dynamics. We're going to talk about that next time. That will talk about like the math and some of the theory behind increase. What I want you guys to do, we've kind of talked about some of the things that affect human population growth. I've set up this Padlet. It is on PowerSchool. And I want you guys to click on here and add things that you think might change the rates with which people are going to like have babies. So how many babies each person would have, things that might change population growth at all. So you can focus on babies, you can focus on deaths, you can focus on immigration, emigration. Any of those 4 categories will change your population growth rate. So put them in here. If you think it is going to slow population growth, color it red. If you think it's going to increase growth, color it green. And if you think, if it's a question, if you're not sure what effect it would have, color it blue. We're going to kind of talk about all of these as we go. Some of these people have put it in black. I think those ones should both be kind of blue. So I'm going to go ahead and change them. But go ahead and you can add it. Again, this is anonymous, so we're not going to see who did what, but it should give us some good ideas on things to discuss. All right, any questions? Okay.